So the diagnosis of breast cancer can come from a couple different sources. The most common one is a lump that's discovered. Then a biopsy is done, sent off to get the report to see if it is cancer or not, which can be a very anxious period for most women, of course. If it does come back that it is breast cancer, then it's staged following that. So basically a CT scan is taken to see if it's moved anywhere. And for breast cancer patients, there can be movement to several different places. It can go to bone, it can go to liver, it can even go to the abdomen, it can go to the brain. There's a bunch of different places that each of the cancers tend to move to. And if it's a stage 4, it's considered that's incurable. Stage 1, 2, and 3 are considered, and we also have a preamble to that, which is ductal carcinoma in situ. It's just a fancy name to say that there's a tumor there in the breast that hasn't spread or moved beyond where it's put. So there's all those stages, and we see patients of all stages. Mostly we see patients of stage 4 cancer from all over North America who come in. And they're, of course, wanting an effective treatment for that, whether it's naturopathically or whether it's using the naturopathic in combination with chemotherapy. The problem with chemotherapy and breast cancer is one of the ones that it's used quite often, is that it tends to not, if it doesn't work, then it tends to come back with a full throttle at the end. It tends to come back like a tsunami. It's because it's the cancer stem cells that are not targeted by chemotherapy. Chemotherapy will hit tumors and it can do a good job at shrinking tumors. Then 2 years down the line, 3 years down the line, whatever it might be, it comes back with a full force. And that's because it hasn't swept up the stem cells. The cancer stem cells sit beneath and they're not visible. You can't see it on a CT scan. So they'll get a CT scan that says a tumor is in the breast or it's in the axilla, which is the armpit, and it's 1.7 centimeters, and they label where it is. With having the reports like that and the movement of the cancer, we want to cut off the stem cells at the same time. The natural medicines do that. So the natural medicines are one of the few medicines that actually hit the cancer stem cells. And the cancer stem cells are the little seeds, the little dust that can grow into the tumors later on. And that's the part that's missing from the chemotherapy side of things. And that is the complementary part to it that works so well, is that you don't want that cancer coming back like a tsunami. You want those cancer stem cells taken care of, and some of the most available agents and the best agents are the natural agents that take care of that. So using that in complementary is a dynamite combination.